viewers watching us around the world. I am Saida Fatma, tonight's host for the series called Youth Empowerment Series, where we say yes to the better future. So just a small recap, what is Tatawwar? Tatawwar is an interactive online and face-to-face program that brings together students aged 15 to 18, schools, parents, and the business community to innovate for a sustainable future by addressing the three United Nations Sustainable Development Goals that are first, health and well-being, which is going to be the topic of today. Second, clean water and sanitation. Third, climate action. Now, what does Tatawwar mean? Tatawwar meaning to develop in Arabic encourages students to learn and apply core future skills in the areas of innovative design thinking and futuristic thinking and entrepreneurship, using a blended learning to empower the youth. The Tatawwar helps the students to come up with ideas. Now, the first three edition of the program has been seen more than 10,000 students from over 2,800 schools around the MENA region, including the Middle East and North Africa. Registering and blending and learning helps the students to come online and mobile-first strategy, giving us the accessible to all students to come and participate. After building the solution on the online platform, the talented youth with the best solution are invited in the workshop closest to them. But given the impact that the Tatawwar has on the communities across the MENA region, it has been recognized internationally, winning several prestigious awards. The program won 2 global awards at the Gulf Sustainable Award 2021 for Best Learning and Education, Program for Best Community Development, a Bronze Award in International CSR Excellence Awards, and was also shortlisted in the Global Goods Awards for Education Excellency and Special Guest Awards for innovative categories. Now, what makes the award 2021 to 2022 more special is that our finalists will be taking place in the Expo 2020. Now, for today's episode, we're going to focus, like I said, on the United Nations Sustainable Development Goals, third, which is the good health and well-being. And I say this because it promotes healthy lifestyles, preventive measurements, and more effective healthcare for everyone. We have us with today are some excellent special guests, and we're very honored to meet and talk with them. We have with us Dr. Ahmed Masood and Mr. Saif Ansari, Malak and Sean, who are the Tatawwar's 3rd edition ambassadors. I'm going to give now everyone a turn to introduce themselves, and once we're done, we'll dive into our very interesting topic that is about healthcare. So I'm passing to Dr. Ahmed Masood, who's going to speak about himself a little bit.
Thank you, Fatma. My name is Dr. Ahmed Masood. I am an attending physician. I practice in suburban New York in a town called Rhinebeck, and also at another hospital called Vassar Brothers Medical Center. And I'm originally from India, and I've been living in the US since 1993. I've done my residency in Buffalo, New York, and since then I've been living in the Hudson Valley. And I was also an educator at New York Medical College for about 15 years. And now I'm in group private practice now. Yeah. So I'll pass to the next speaker.
That will be Seth.
Hello, everyone. My name is Seth. I'm a current medical student, an MD MBA candidate at the Geisel School of Medicine at Dartmouth College. That's located in New Hampshire, US. I was born and raised in New York. I did my undergraduate degree in music, actually, which is an interest of mine, but decided that I wanted to go into medicine. So I'm currently in the MD program. Just last year, I decided to apply to my school's dual MD MBA program. And I was accepted to that. So I will start business studies next year. I have somewhat more limited experience than Dr. Masood because I am still a student. I'm only 26 years old, but I have been completing clinical rotations at various hospitals throughout the US in the last several months. So I think my perspective will be somewhat more limited, but maybe more accessible to some of the younger students out there who are looking for insight into what their futures might look like. Thank you.
Thank you, Seb. That was wonderful. Moving on to Malak and Sean at the end. Malak, just to say you're muted. It's totally fine.
Hello, everyone. Again, this is me, Malak Ali from Egypt. I'm actually a Tatawwar ambassador, and I'm a volunteer at the Egyptian channels as a TV presenter for like 6 years now. I started studying dentistry and planning to do double major to study also bioinformatics. So since I'm really interested in how AI can actually have a great impact in many fields and many life aspects, certainly the health well-being field. And so my idea last year was about obesity, and I was tackling the well-being, the healthcare well-being field.
Hi guys, my name is Sean and Shaju, and I'm from UAE, Dubai. I'm the Tatawwar ambassador of 2020 to 2021. My idea was a mental health app named Bliss. This provides users with the services of a listener, motivator, and a therapist. Thank you.
Thank you, everyone, for that wonderful introduction that we could get a little better to know you guys. Now, let's dive into the interesting, and I'm very excited to ask some questions to Dr. Ahmed and Seth, which will be my first question is, why did you choose to pursue a career in healthcare? I would like to know that.
Who's going first, Fatma?
You can go first.
Okay, thank you. When I was about 7 years old, my mother fell and fractured her hip, and she was in the hospital for a very long time. And I had at that time 2 younger sisters, and my father was studying in England. So it was an interesting perspective for a 7-year-old to be under care of his uncle, who very graciously spent almost a year with us at that time. That shaped a lot of my perspective of healthcare at that time as a child. Obviously, your perspective is very different as a child of a parent who is recovering, and at that time there were not a lot of pain medicines, and she had orthopedic surgery. I think she had 2 surgeries and a prolonged recovery. So that shaped a lot of my perspective. And then when I grew older, I felt that I wanted to help patients and people. So that was really the reason, because growing up in India, you have to decide your career path at pretty much at the age of 17, which is very different from Western countries where you might finish 4 years college before you make a decision, or towards the end of your college where you make decisions regarding your career path. So as a result, the Indian system asked for a commitment one way or the other, and I felt that medicine was the way to go because of, I believe, these 2 defining characteristics. And also I like biology and life sciences a lot. So that's, I think, an answer to your question, Fatma.
I think that was a passionate story behind how you became a doctor. What about you, Seth? I would like to know how you choose to be in the healthcare system.
Yeah, it's very fitting that you would ask me after Dr. Masood, because He's actually my father. And so my experiences and my impression of the healthcare system were shaped from a young age by witnessing him in his practice when I was a very young boy. Seeing the kind of work that he did, it really made an impact on me. And fortunately, in our family, there was no pressure for me or my brother to go into medicine. There was really no pressure for us to go into any specific field. We were just kind of encouraged to follow our natural curiosities. And so I think I was always curious about how the body works because I was always impressed by how much my father knew about basically any question that someone could come to him with. For example, like if a friend asked him, "Hey, I have this mark on my skin. Can you take a look at it?" He might have like either a solid answer to what that is, or he might know how to look it up. And I thought that was just so cool. So I kept that in the back of my mind as I was getting older. And I play the viola. I started playing the viola at the age of 9. So for a little while, I actually thought about maybe becoming a professional musician because I also found that just fascinating. There's so much in music and there's so much overlap between music and medicine. But I think when it came down to it, I decided that I wanted to go into medicine because I think a life of service is something that I just really wanted to have. Being able to serve others and at the end of the day help people is something that's the most profound thing that everyone has, which is their own health. That seemed like the best fit for me. And so far, my experiences in medical school have only confirmed that for sure.
Very happy to see that you're carrying on your dad's legacy, don't we? My next question would be to Dr. Ahmed and so to Seth, is what are some biggest strengths and challenges in the healthcare system right now that you would like to address? After you, Dr. Ahmed.
So I can talk about the US healthcare system, Fatma, if that's what you would like me to do.
It's totally fine.
Okay. So from that perspective, because we have an international audience, which I feel honored to be addressing young people who are so far away and so interested in all this. But that being said, the strength, I believe, is that science has advanced in my 25, 28 years of practice, and before that, 10 years of study. Has advanced so much. It is truly amazing just looking at even the rapid pace at which a successful vaccine for COVID was developed was unthinkable when I was a student. There was no discussion of, this type of technology that the genome could be sequenced in weeks, and then a successful vaccine could be produced and then tested and approved and used and found to be effective. So something like that is truly 21st century medicine. So something like that, I would say, is a strength of the current system. My perspective, I guess, points more towards the technology as being the strength. But also, I think the age-old qualities of being a good physician and listening to patients and things of that nature. But those those transcend. Whether you are here in Europe, in Asia, in Africa, or other countries, Middle East, that doesn't change. But I would say that the pace at which technology is evolving and being put to good use. Also looking at the Nobel Prizes that have been recently awarded and things of that nature, I believe should be looked at by youngsters who are interested in pursuing a career in medicine or are curious about it. You wanted me to also discuss the weakness?
Yes, if you can. I think we'd like to know the both sides, the reality and the expectation of med school or like healthcare system in general. Okay, so in the US, the biggest weakness I would say is that different healthcare systems, by which I mean different healthcare plans, different population groups that are served because the United States is such a big country, they do not talk to each other. There's no interconnectivity.
So if a patient moves or is traveling, let's say from New York, where I work, to another state, even nearby in New Jersey or Connecticut, or far away somewhere like California, and they get ill, they go to the emergency room. There is no way for the doctor in the ER there to look up this patient's medical records and make a meaningful decision. They have to start with sort of a blank slate, which I find to be the biggest weakness, that there is no interconnectivity of what's called the electronic medical record of a patient. Same thing if they come to my hospital and they're ill, it's frustrating because you have to resort to what we would call old-fashioned technology, whereby we have to call up the doctor in the other state or send a fax and then wait for a few days for prior labs or imaging studies to come up. And even then the information is partially available. So that would
was
be a big weakness.
a very interesting opinion that you just stated. I think we would never know unless we've been said. What about you, Seb?
I think my response to the biggest strength of healthcare today is quite similar to Dr. Masood's. I think we live in a truly unprecedented age, and I think that our generation lacks perspective on that, naturally because we're only as old as we are. But if we take a historical perspective, technology in all realms, especially healthcare, has never seen such a rapid pace of development. If you look at the advancements of just the last 100 years, we've never had a period like that in human history where within 100 years, so much development and so much technology has evolved to be able to help people in healthcare. So that's something that I think is one of the biggest strengths, is simply that technology is moving so quickly and medical advancements are moving so quickly. But I think it's also one of the challenges as well, because while these treatments might exist, they initially always start as being available treatments for people at the top, essentially. So people living in like so-called first world countries or developed nations, people who have access to healthcare, people who have good health insurance, people who have means to reach out those treatments. We have available treatments for so many illnesses that are entirely preventable, yet many people worldwide still suffer from these. And it's simply because there's just not as much access to care. So while I think it is one of the biggest strengths that technology has evolved so quickly, medical technology specifically, I think the real challenge is just getting access to everyone in a sort of equitable manner.
That is great to know. Lastly, I just wanted to ask, I think you both emphasized on some points on this question, is what will be more advanced healthcare system look like in the future, and what big changes do you expect to see in the future? Dr. Ahmed, to you.
Let me warn my listeners, there's some background noise. Unfortunately, I'm dialing in from home. It's Saturday morning, so apologize for that if you hear any noises. The system would look, I believe, an interconnected system to me, I think, is something that on a practical note, I would like to see. As I was mentioning, it is a challenge where it's not, the interfaces are not interconnected. I believe, I'm told, the technology exists, but it's the regulatory environment that is currently, because some of it, I think back that the US is constitution, and going back 250 years, it was designed as a federal system whereby the states have autonomy in a lot of lawmaking and rules and regs. So each of the 51 states has its own rules about healthcare, and that makes it difficult for these systems which house data about the patient to interconnect. The second thing I would like to see is more, one of the panelists mentioned AI, more use of AI in a predictive model of what's going to happen to the patient and maybe intervene ahead of time rather than waiting for like an intensive care unit patient, an ICU patient, maybe about to what we call crash, that, they might be going into shock or about to have a myocardial infarction or a heart attack while under our care. This is more so for hospital medicine, but also true for population health, such as somebody who may be at risk of developing a heart attack to be treated more aggressively. So how we can predict these patients, how we can predict future events based on either blood tests or monitoring of vital signs and other different, data points that can be brought together to talk to each other. Also a smart search feature that could be built in, like a Google search type of feature that could be built into patients' electronic records, because everything is electronic here. Unfortunately, as compared to India or other developing countries where everything is on paper, that's not searchable and that's not smart data. So moving ahead, jumping to a first world country, you're looking at these advances, but you're also facing challenges by the same token. So those, I believe, are things to look for, and hopefully the next generation will be able to work on that.
I totally agree what you said. Some of the ideas that you presented may be coming soon, and that soon could be tomorrow also, and maybe by our viewers and participants who can implement that. So what about you, Seth?
To keep it brief, I think the area that I can best address within healthcare is probably the medical education system. Right now, there's a worldwide shortage of physicians. And this is an issue that's present in the US, and it's probably present in the UAE and elsewhere, really. So I think in the coming decades, there will probably be a lot of changes in how we educate physicians and other healthcare workers. I'd hope that that the medical education system would move towards an attitude of including people. In the US, the medical education system, it's very competitive to get into. And they really ask a lot from their students. And I think that while it's absolutely necessary to have like a rigorous education, I don't think it's entirely necessary to make a student jump through all of the hoops that they need to simply in order to become a physician. Becoming a doctor in today's age is not like it was in my father's time or in decades prior. It's truly a very difficult feat for most people. So I'd hope that medical education would become more accessible to others, and likewise that people in other roles besides a physician's role will be more involved in care, like nurses and what we call mid-level practitioners, like physician's assistants and nurse practitioners. I hope that they'll be included in the future as well.
Thank you so much, Dr. Ahmed and Steph, for delivering such great responses and sharing your perspective. Moving on, I would like to introduce Malak and Sean, who are two amazing young individuals. Guys, I would like to ask the first question, that is, what were your ideas in general? Malak, you can answer first.
Okay, so my idea actually was an app that helped people to lose weight. It's not just about losing weight, it's about to make the world even more interactive. My app was called Khasisni, and Khasisni means help me to lose weight or make me lose weight, but in Arabic. I insist to do everything in that tradition, the Arab society traditions, so it can be originally all the people, even it became viral, all people all around the world know that this idea was originally made or someone came up with it, someone Arabian. So my idea simply was an app that provides everything needed in order to lose weight, including healthy meals, including workouts. I even said to add that powerful goal from the belly dance and how belly dance can help people to lose weight. I also add nutritionists and gym trainers, and people, if they go through the premium features, can even find out that the app can calculate their own calories, and those calories automatically can be transformed to coins, which are actually vouchers that they can use in shopping. My idea actually included everything that would help people to lose weight and help them to lose weight, because I've made a survey to ask people what really stops you to lose weight and what is the big obstacle or the big hurdle that you face in order to lose weight. And most of the comments I received is that we lose that interest and this energy, or we couldn't be nothing encourages us to be fit or to get fit or to lose weight. And for that reason, I added that part of the voucher and the shopping to help people to become really encouraged to lose weight.
Malak, I think I love your idea already. I've heard it in the semifinals.
Oh, thank you.
After you. After you, Sean.
Awareness of mental illness and the need for treatment has been growing in recent years. But despite this progress, many people need help for mental health issues, but they don't seek help. A study by the World Health Organization, or WHO, found that between 30 and 80% of people with mental illnesses don't seek treatment. So that was the issue I was providing a solution for. Bliss is a mental health app that provides us the services of a listener, motivator, and a therapist. Well, what makes Bliss different from our traditional therapy is the personalized journey that we provide. Personalized journeys have been designed to give users time to reflect and bring out their thoughts, worries, and assumptions. This allows the user to be fully aware of their illness before seeking the help of a therapist. Research has revealed that self therapy allows people to keep their emotions stable and maintain their relationships and empowers them. Bliss helps you go through their healing process in a step by step manner.
So thank you, Sean, for sharing your idea. Malak, your idea was on a health app focusing on obesity, and Sean, yours was on mental health. Quite curious on how did you both came up with your research, and what key findings that spark even more bigger interest in pursuing your vision with your apps?
So actually, as I said before, I've done a survey asking relatives and people around my area to like simple questions. It was a Google form, a survey asking people what their big issue with obesity and what stopped them to lose weight, and what do you really need to be provided in order to help you to get fit, and started to receive many comments. Then started to read more about obesity and how it originally that idea of obesity came up with. And I started to ask people that are enrolled in this field. And then I also started to ask people and went to groups that's, simple groups made by women. Actually, one of them was WOM. My mom was an admin of such groups, asking to all people or all women in the town to make that a WhatsApp group that helped to lose weight and to have that healthy lifestyle. So I started to go down with them and ask people around what you really need in order to lose weight, how can I help you, and started to take notes. And really what really sparked me, that people started to tell me, please do that app, that would help us. If you just collect everything and provide that thing, it would really help us very much. So that what really made me move on and started to keep on searching and keep on improving my prototype, improving my own idea. And even if after I finished the Tatawwar experience, that really taught me lots of things. One of my relatives asked me to go on and to change this idea into reality. And I refused. I refused because I needed some more time to discover more about mobile applications, to know better about obesity, about healthcare problems. I needed to know all the issue from all aspects in order to change this idea to reality. I need to be that expert in it in order to deliver the best of it.
That was wonderful, Malak. What about you, Sean?
Saida, that's a great question. Research can often lead us from one thing to another. We may begin somewhere and end up somewhere else. So initially, I researched on trying to meet the needs of patients, and online therapy met a majority of the needs. But upon further research, I realized that online therapy was insufficient. Some people work well with the therapist, but others prefer to deal with their own issues. And self therapy allows people to identify thought patterns, discover how your thought affects your actions, and realize that your actions influence your emotions. And that's how mental illnesses are formed. So I designed personalized journeys that brings together both self therapy and traditional therapy to better meet the needs and provide an effective treatment.
Thank you, Malak and Sean. It was great hearing from you. Wishing you all the best and success. We're coming to the end of today's episode, but before we go, I'd like to welcome Umayma, who will take over her segments and latest insights and trends. Up to you.
Thank you, Saida. You've done wonderful again. Hi, everyone. Glad to be here. So for today's insights and trends, I've decided to focus on health as well. So ecosystems create powerful forces that can reshape and disrupt industries. In healthcare, they have the potential to deliver a personalized and integrated experience to consumers, enhance provider productivity, engage formal and informal caregivers, and improve outcomes and affordability. When the COVID-19 pandemic hit, pharmaceutical and research firms set out upon a global mission to develop safe and effective vaccines to bring the virus under control and return life around the world to something approaching normal and quickly. In less than a year, Pfizer and Moderna crossed the finish line first, bringing novel two-jab mRNA vaccines to market with extraordinary speed and with an outstanding efficacy rate. Vaccine makers started with an outcome in mind, and in countries with plentiful vaccine access are delivering on those outcomes. But not all outcomes need to be so lofty to be effective. Maybe your innovation aims to improve patient compliance with at-home treatment plans, or increase access to quality care among underserved, impoverished communities. A great example would be Alertive Healthcare, a company that wanted to meaningfully improve round-the-clock care for when patients couldn't get in to see their physicians. They developed a platform for clinical-grade remote patient monitoring. Patients download an easy-to-use app that sends intelligent alerts to providers, reducing documentation and decreasing time to treatment. Patients enrolled in the app reduce their risk of heart attack and stroke by 50%. That's a compelling value and an example of designing for outcomes. Speaking of which, when designing for outcomes, it's also important to know precisely how you'll measure success. When you can point toward quantifiable metrics, you're not only giving yourself goals in your product design and development, you're also establishing the proof points that sell your product into the market. So that's all for me for this week. Thank you and see you next time.
Thank you, Umayma, for the wonderful words. Now, just a little reminder, students can register for the program at tatawwar.com. Schools, parents, NGOs, any partnership would like to empower the youth. You can follow us on social media as well. That's on Facebook, Instagram, Twitter, and we're also new on TikTok. And join us next week for our next episode with Amal, who will speak for her topic. Thank you, everyone. Thank you, our guests and the Tatawwar ambassador who came with us and spoke about the topic. It's really an honor to meet all of you. So see you next Saturday.